HLST 320, Janine Dubois, student ID number is 3105981. I will be teaching a family of a patient, Margaret, who is 87 years old and has dementia. She had fallen down and broken her hip, which required hip surgery. The learning domain will be based on the cognitive of Bloom's taxonomy. The objective of the learning domain will be directed towards the daughter and son-in-law of Margaret for the development of an effective understanding towards the subject matter of preventing future falls. Based on the diagnosis of dementia, I will assess prior to teaching the understanding of the family's knowledge to falls and fall prevention, followed by the discussion with the family. Hi, my name is Janine. I will be teaching you fall prevention for your mother, Margaret. First of all, I would like to discuss some of the facts of falls within the senior population, followed by the purpose to the falls. According to the Alberta Health Services, falls are one of the main causes of injury and loss of independence in people ages 65 and older. Public Health Agency of Canada states 20 to 30% of the elderly experience one or more falls each year, which 85% of falls are the cause of hospitalization. Also, 95% of falls result in hip fractures. This here is the handout that you can follow along with. Now I will go on to the purpose of the falls. So the purpose to the falls and recurrent falls are not all, but which some are balance impairment, decreased muscle strength, visual impairment, more than 4 medications, gait impairment, and walking difficulty, depression, dizziness, functional limitations, incontinence, cognitive impairment, arthritis, diabetes, and pain. It's common to see a multiple of these factors in combination, which does increase the risks of falling. The significance to preventing falls in the senior population is to prevent any further trauma to Margaret, such as secondary illnesses due to falling, which could lead to pneumonia, pressure sores, DVTs, and even dehydration, just from an attempt to recover from a fall injury. Often an elderly patient falls, they are afraid to fall again, which may prevent them from walking or moving. So how would you solve fall prevention, and what can be done to minimize these falls? Well, we need to look at the information that was discussed and think about how to prevent another fall from occurring. We need to find a way to better care for Margaret. Maybe taking vitamin D and calcium to promote stronger bones. Margaret can also get her eyes checked every year if she or you notice any changes to her vision. If you notice that she may be unsteady on her feet after getting up, it can be caused due to dizziness from her medications or even a low blood pressure. As for taking care of her at home, we can go over some information from the Alberta Health Services to preventing further falls. And here is another handout that you can take home. Making the home safer, such as removing or fixing any doorway thresholds or removing throw rugs from the floors. Decluttering the home from all areas of the home and keeping the home clean and slip-proof. Putting handrails on both sides of the stairways and storing things on lower shelves for better access. Installing grab handles in the bathroom and using a chair or a bath bench in the tub. Learning about medications is also a beneficial way to preventing falls. Medications in combination sometimes cause dizziness or sleepiness. Making an appointment with the doctor to address any medications that may contribute to falls, such as sleep aids, blood pressure medications, or antipsychotics that may cause sedation, or preventative ways to ensuring safety. Exercise promotes balance and strength and is a good way to keeping active. Here's an exercise plan to strengthen the muscles in the upper legs and the buttocks that will promote standing and walking efficiently. Now that we went over all the information, how can you determine if the information provided will ensure your mother's safety? I have a brochure and a list of safety that has additional website information and phone number if you have any further questions if needed. And I will also provide the exercise sheet that provides instructions on how to do the chair rise exercises. Do you have any questions? Good. Thank you for your time.